Hello, everybody. My name is Katie O'Leary, and today you are joining us on Beyond the Curve. I am sitting here with the lovely Selena Ramirez, and today's topic is going to be about violence and the way it impacts health outcomes. Selena Ramirez has a background in public health with a specialty in epidemiology. Selena, could you start by telling me a little bit about what led you to focus on violence as a public health issue, particularly in the context of the social determinants of health?
Yeah, definitely. First of all, thank you so much for having me on your show. So, to answer your question, my interest in violence as a public health issue started from the recognition that violence is not just a social or criminal problem, but it's also deeply rooted as a public health challenge. So, historically, we tend to view violence as an isolated term, so we focus on the incident itself without fully considering the broader social, environmental, and economic factors that can influence it. So, social determinants of health like income inequality, access to education, neighborhood safety, and social support systems play a critical role in shaping violence outcomes. So, essentially, I became interested in how these factors kind of intersect and how addressing them can help reduce the public health burden of violence, not just as an isolated incident, but also as part of like a broader cycle of health inequities.
Yeah, that's actually pretty awesome. I would definitely say that there's a lot of misunderstanding when it comes to violence. People think that it's often a single person or a two-party issue, when in
Exactly.
fact it affects so much more and it's affected by so much more. So I really appreciate you bringing that topic to focus.
Definitely. Thank you.
What are some overlooked social determinants of health that contribute to violence beyond just common factors like poverty and education? I think you had already kind of talked about it, but could you go a little bit deeper into it?
Yeah, of course. So, besides poverty and education, I would have to say that environments, and more so specifically like neighborhood environments, are an important yet overlooked social determinant of health. This includes like the availability of safe public spaces, recreational areas, and effective community policing. So these are definitely very significant factors. Another overlooked aspect is social support. So, communities with high levels of trust typically tend to experience lower levels of violence because individuals are more likely to intervene, prevent conflicts, they know each other, and provide support for those in need. Additionally, I would say that access to mental health services and just health coverage in general is also a critical social determinant issue that is often overlooked. For example, untreated trauma and mental health issues can significantly contribute to violent behavior.
I would definitely agree that the neighborhood environment has a lot to do with it, and a lot of communities actually lack those vital resources. And it's kind of sad to see that a lot of neighborhoods that, if provided with mental health resources early on, or I know some programs have these things called violence disruptors. Well, they'll go into communities and kind of figure out the source of problems. But if we're not figuring out what sources are needed, or where stuff can be best helped, then we're not doing anything to help. We're just enabling this process.
Very well put. Definitely agreed that we need like some sort of needs assessment into these communities to explore what is missing, what is causing, these like violence outbreaks. But yeah, very well put.
How would you say that violence impacts behaviors that are typically linked to healthy lifestyles, such as like outdoor activities, access to nutritious foods?
So I would say that both community based and domestic violence tend to create an environment of fear, as well as instability that can have a direct impact on health behaviors. So, for example, in communities with high rates of violence, individuals may avoid outdoor activities like walking, running, even just walking down the street to go to your local grocery store, or socializing in public spaces due to safety concerns. This can ultimately limit physical activity, which is vital for both physical and mental health. Additionally, when families are living in fear, they may prioritize short term survival rather than long term health behaviors, which affects their ability to access or prepare nutritious meals. Domestic violence, in particular, can lead to social isolation, by restricting access to community resources such as food assistance programs and even local support networks.
So, the exposure to community violence during adolescence, such as witnessing involved altercations, contribute to later mental health and chronic conditions. How do you think that this exposure, shapes adolescence on a future?
Yeah. So I would say that adolescents that are exposed to community violence are typically at a higher risk of developing both mental and physical health issues. So the trauma experience in youth, whether it's through direct involvement or witnessing violence, can lead to conditions like post-traumatic stress disorder, anxiety, depression, and some even develop substance abuse issues. So these mental health issues often persist into adulthood, which contributes to chronic stress, and can also cause other chronic health conditions such as hypertension, heart disease, and diabetes. So it essentially becomes an ongoing cycle. This ongoing exposure to violence can also impair the development of coping mechanisms and emotional regulation, further increasing the likelihood of engaging in risky behaviors, including substance abuse or violent behavior.
Yeah, and it's sad to see that the youth that is exposed to this like violent crimes or different domestic violence as well. A lot of schools, they can barely afford to have certain resources, and a lot of schools teachers aren't allowed to get involved in things. So it's kind of interesting that I think there should be more community resources out there to help youth and tackle issues now, so that later on in life they can develop those coping mechanisms that you're talking about.
Yeah, definitely.
In terms of domestic violence, what are some chronic and mental health effects that tend to develop in survivors?
So from the research that I've been doing, survivors of domestic violence often experience both physical and psychological long-term consequences. So, for example, in terms of chronic pain and injuries from physical abuse, that can linger long after the immediate violence has ended, due to just health complications and that sort of thing. So, survivors, they're also at a higher risk of developing, of course, mental health issues such as PTSD, anxiety, and even potentially suicidal ideation. So the psychological scars can be just as profound as the physical ones, affecting self esteem, trust in others, and the ability to form healthy relationships in the future. Survivors may also experience eating disorders, have difficulty sleeping, insomnia, and substance abuse as coping mechanisms. So I think it's definitely really important because a lot of the interventions that I saw would essentially just target how to prevent violence, but I think it's also important to consider the survivors and how we can create interventions that helps them um, essentially get their life back.
Yeah, exactly. I believe that in certain situations it's great to prevent these things, but if it's already happened, it's all about women are going to live with this for the rest of their lives. So how can we help them better cope with it and turn it into resilience, essentially. I've heard a lot of stats about how there's a big socioeconomic impact for women as well, in terms of housing and employment. I think it's a lot of times people find it hard to get out of the situation that they're in. Could you elaborate a little bit more on that?
Yeah. So so I would have to say that, for example, with domestic violence, intimate partner violence is one of the biggest aspects within this category. So I would say that it has a significant socioeconomic impact, as many women who experience IPV find it difficult to maintain stable employment. This can be due to physical injuries, emotional trauma, or an abusive partner who undermines their independence. And this can further lead into them developing an economic dependence on the abuser. So this further traps them into a cycle of violence. Housing is also a major issue where victims often face eviction or homelessness when trying to escape an abusive relationship, especially if they don't have any financial resources or family support. In many cases, I found that women may not have access to affordable childcare or transportation, which further limits their ability to secure stable work or housing. So this economic instability can make it so much more harder for victims to escape the cycle of violence and can perpetuate a range of health disparities and potentially also pass them along to any offspring.
I would definitely say that, you touched on a lot of things, a lot of social determinants of health that, many people overlook or, they don't have the courage to talk about. I appreciate you bringing all of those things up. And I hope that, the women out there that are listening, I hope that, if I will, at the end of this podcast, I'll link resources out there in Texas that, you can always look at and see. And a lot of those resources are anonymous as well.
That's awesome. Thank you.
So your research highlights a need for more qualitative data. What specific insights do you hope qualitative data can bring to the study of violence and health outcomes?
So, yes, as you mentioned, most of the research that I was touching up on provided more so quantitative measures. So I believe qualitative data is crucial because it provides a deeper, more context-specific insights that quantitative data alone cannot capture. So while surveys and statistics can highlight patterns, qualitative research, on the other hand, through interviews, focus groups, and so forth, they help us understand why people engage in certain behaviors or how they experience violence and its aftermath. It also allows us, for survivors to share their personal narratives, which can uncover barriers to seeking help, like their coping strategies, and the role of community and family support in terms of recovery. So these insights can inform more tailored, effective interventions and policies that offer a holistic view of the problem.
I would definitely agree that as far as like qualitative goes, I think you can't put enough importance on hearing people's voices. People are more than just a statistic. So I think it's definitely important that, we hear those voices. So I appreciate you bringing that sort of need into your research. Looking forward, how do you hope research can influence policy change or funding initiatives to support communities and individuals affected by violence?
So my hope is to help shift the conversation around violence from being seen as a criminal issue to a broader public health priority. So this involves advocating for policy changes that recognize the social determinants of violence and support interventions that address these factors. So whether through improved access to mental health services, affordable housing, or community-based violence prevention programs, I hope to see that funding initiatives that focus on prevention and early intervention, particularly in marginalized communities, and I really hope that they include the voices, as you mentioned, and needs of survivors in shaping these programs. So ultimately, I'd just essentially like to see more collaboration between public health, criminal justice, and social services to build a more integrated approach to preventing and responding to violence.
I like that approach. I think a systems thinking approach is definitely something that's needed in a lot of communities, especially. How do you think communities can work to break down the barriers that survivors face when seeking support?
So survivors of violence often, face a range of barriers when seeking support. This can include anything from fear of retaliation, lack of trust in authorities, shame or stigma, and lack of access to resources like shelters or legal assistance. Some survivors may also fear losing custody of children or facing further financial hardship. So, one way that communities can break down these barriers is by providing confidential, accessible, and culturally competent services, creating safe spaces for survivors to speak out, and offering education and outreach programs. And this can all be done to raise awareness about available resources. Essentially, the ultimate goal is to build strong community networks of support, including peer counseling, survivor advocacy, and also make it easier for individuals to come forward.
I think those are all awesome resources. Thank you so much for, kind of explaining them, explaining those barriers too. I think a lot of people have, again, misconceptions of what the barriers are.
Mm-hmm.
And the different types of resources. I think many people may not even know that those things exist. So I appreciate that.
Yeah, definitely.
For the listeners that are listening today, what do you think there could be like steps that they could take in their own lives to be allies or advocates for violence prevention and support those who are actually affected by violence?
Yeah, so I would say one of the biggest things that we can do is to educate ourselves, about the signs of domestic and community violence, as well as, educate ourselves on the resources available to those affected. It's also important to be active bystanders. So I would say if you're capable, if you witness violence or suspect someone from being in danger, speaking up is one of the biggest things that we can do, or offering support can make the biggest difference. So for those who are comfortable being a public advocate for policy change, such as advocating for more funding for domestic violence programs or community safety programs, that can also help create systemic change. And lastly, supporting local organizations or volunteering with shelters, even in hotlines or counseling services, is another way to, help those directly affected by violence. There's, a ton of different shelters in our areas that, can take anything from, monetary donations, even clothing. There's so much that we can do within our local communities, just, see what's out there and we can get started.
Thank you so much. And for all those listeners, I do encourage you guys to check out the links that I've provided in this podcast, but also check out local community resources. And like Selena said, it just takes a little bit to be an ally, but I think we all can do our part. And who knows, somebody in your life may be experiencing violence and you may not know it. So a little bit can do a lot.
Definitely.
Thank you guys again. Thank you so much, Lena. I appreciate it.
Yeah, thank you so much for having me today.
And thanks, everybody. We will see you guys next time on Beyond the Curve.
Woo!